physician, Dr. Massimo Giola. Massimo, we need to step up our response to monkeypox here in New Zealand, don't we?
We do, and not just in New Zealand, but worldwide, really, because the outbreak is growing at a very fast pace. And sadly, we are seeing also the first few deaths caused by monkeypox in Europe and Asia ever. So, yep, it's definitely an alarm bell ringing.
Well, I want to talk to you about the virus, Massimo. Monkeypox isn't typically deadly, but it is extremely unpleasant, isn't it?
It can be, and also this outbreak is behaving in a different way from classical textbook monkeypox, and there are also some early signs that the virus might be mutating and evolving, adapting more to human hosts, but also potentially causing different pathology than what it used to.
Well, right now it's spreading among men who have sex with men, but that could change if it continues to spread unchecked, couldn't it?
Absolutely, and that's the pattern that has been followed by many STIs, starting with HIV perhaps. So gay and bisexual men tend to be, as I say, the canary in the coal mine of STIs, and then you normally see a spillover to the general population. For example, that's exactly what happened with syphilis in Aotearoa over the last decade. We saw in 2011 the cases go up among gay and bisexual men, and only a couple of years later we had cases in the general population, including congenital syphilis cases. So yes, that's definitely a worry and something that's probably going to happen.
Well, Massimo, how is the gay and bisexual community responding to this new threat here at the moment?
Well, the gay and bisexual men community has got a long story of resilience, agency, and proactive and positive health-seeking behavior in front of infections. I see in clinic pretty much every day guys who are on PrEP or are using condoms to keep themselves and the community safe, and coming forward regularly for STI checks to keep themselves and the community safe. So the community knows what to do, and the community needs to be listened to and not to be told what to do in a top-down approach. The community has got the solutions, and I hear in clinic every day gay and bisexual men telling me, when are we getting the vaccine? We want the vaccine to protect us and the rest of the community. Or guys telling me, I'm ready to decrease the number of my sexual partners if I have to, as soon as monkeypox is in New Zealand. So the community is well aware and ready to fight this virus.
And just needs the support, I suppose, of the health system and the government, because it's vital that we get on top of this, isn't it? Because it could become endemic here, couldn't it?
Well, some authors think we have already lost the race with the virus worldwide, and is becoming already endemic among the communities most at risk. I guess in New Zealand we have now a pretty unique opportunity to avoid monkeypox getting hold in our population, but we need to act fast if we want to avoid that.
A message that I hope is reaching our Parliament. Thank you so much for joining us, Dr. Massimo Giola.
Welcome.